Hi dear students, have a nice day. Today's topic is concept of peripheral heart and anatomical basis of the rupture of calcaneal tendon. The output from your heart that is known as cardiac output, which completely depends upon the venous return to your heart. So when a person is lying down, there is minimum gravitational influence on the blood in the body. So adequate venous return can be ensured by low levels of venous pressure. But when sitting or standing in upright, the venous blood in our lower limb must be returned to the heart against the force of gravity. So it requires pressure well above than the usual pressures in the vein. To overcome this challenge, the human body, which relies on skeletal muscles, which pumps this blood or the pooled venous blood as well as interstitial fluid that back to heart. So three lower limb skeletal muscle pumps exist: foot pump, calf muscle pump and thigh pump. The foot pump serves primarily to prime the calf muscle pump, which provides about 3/4 of the fluid returned from the lower body to the heart, while the thigh pump provides the remaining quarter of the fluid returned to the heart. In the absence of movement, though, for example, while seated, muscle pumping is created almost exclusively through the activity of the soleus muscle. So, if there is no movement also, the muscle pumping is there, and that is by the activity of the soleus muscle. These are specialized postural muscles in the calf of the leg, and it contains large venous sinuses that store blood until a reflex response which activates the contraction of the muscle. So if there is no contraction of the muscle also, this soleus muscle, which contain large venous sinuses, which help in the muscle which helps in the venous return. This results in the production of sufficient pressure to return venous blood as well as lymphatic fluid back to heart. The soleus muscle are so critical in returning blood to the heart, and that they have come to be called as secondary hearts of the body. So soleus is also called as secondary hearts of the body. So the cardiovascular system in the upright person should therefore be viewed as two pump system, where the cardiac muscle circulates blood and the soleus muscle return pooled blood and lymphatic fluid back to the heart. In the absence of this adequate fluid return to the heart, the cardiac muscle cannot operate effectively. So, when the cardiac muscle cannot pump sufficient blood to provide nutrients and oxygens to all the tissues of the body, the condition is referred to as heart failure. Inadequate fluid return from the lower body is indicated by symptoms such as swollen ankles, painful joints, varicose veins, and venous insufficiency, nighttime leg cramps, venous ulcers, and poor wound healing and osteoporosis. In addition, insufficient fluid return to the heart causes lower cardiac output and blood pressure, resulting in conditions such as weight gain, chronic fatigue, as well as memory and attention deficits. Secondary heart insufficiency is remarkably common, and around 40% of the women is having this insufficiency in venous return, and that is maybe due to the modern lifestyle of women. Calf muscles is called as the peripheral heart, as its actions pumps the deoxygenated blood back to the heart against the gravity. It is composed of soleus and gastrocnemius, and gastrocnemius have two heads, that is medial and lateral head. And this is situated in the posterior part of the leg, that is below the knee or the upper leg, back of the upper leg, and it is bulkiest because it is anti-gravity muscle. So it is bulkiest, and this muscle have to lift the heel during walking, running, etc. They are the strong plantar flexors too. So these calf muscles, they are known as the peripheral heart, and its action, other action is pumping the blood, deoxygenated blood back to the heart against the gravity. And the soleus muscle, it is also called a secondary heart. It is multipinnate fleshy muscle. That is the muscle of the superficial compartment of the leg deep to the gastrocnemius muscle. This muscle also forms part of the tendocalcaneus tendon. So the tendon of gastrocnemius is also fused with the tendon of soleus muscle and together form the tendocalcaneus tendon, which is inserted to the posterior aspect of the calcaneum. So together these calf muscles, and deep to that there are deep vein system. So calf muscles and deep vein system, which form a complex array of valves and pumps, which often referred to as the peripheral heart, and that functions to push blood upward from the feet against gravity. The muscle is pierced by perforating veins. So perforators or perforating veins, which helps in the communication between the superficial veins and the deep veins. So the muscle, the soleus, is pierced by perforating veins which communicate the superficial with the deep veins of the leg. And these perforators are guarded by valves to direct the blood flow from superficial to deep. Perforating veins from this superficial long saphenous vein or great saphenous vein, which enters the substance of soleus and communicate with rich plexus of small valvulus veins are there within the muscle. They are known as soleal sinuses or soleal venous plexus. So these soleal sinuses communicate with the deep veins of the lower limb. So when soleus muscle contracts, the blood is pumped out of this plexus into the deep veins, aiding in the venous return from the lower limb, hence the name peripheral heart. So the contraction of the muscle, it squeezes the blood centripetally and acts as the peripheral heart. And the soleus is supplied by the tibial nerve. So the veins in the leg, they are connected, the superficial and the deep veins are connected by means of perforators, and these perforators have valves, and this perforators which is connecting the great saphenous vein which enter to the substance of soleus, and the soleus contain rich plexus of small valvulus vein, and they are known as soleal sinus, and the soleal sinuses communicate with the deep veins of the lower limb. So when soleus contracts, the muscle, the blood is pumped out of this plexus into the deep veins, so aiding the venous return from the lower limb. So the soleus, this soleus is known as the peripheral heart. Before pumping has started, the pressure is neutral and equal everywhere throughout the system, and the calf fills with blood, typically 100 to 150 ml. So when the calf contracts, the perforator vein valves are forced closed and the outflow valves are forced open, driving the blood proximally against gravity. So when the calf is allowed to relax, the veins and sinusoid refills from the superficial veins via the perforator veins, and the outflow valve is forced shut, preventing the retrograde flow. So with each contraction, 40 to 60% of the calf venous volume is driven proximally. So in the upright posture, the soleus is responsible for pumping venous blood back to the heart from the periphery and is often called the skeletal muscle pump, peripheral heart, or the sural or tricipital pump. Some important points regarding the veins you have to remember in the lower limb. One is that all the veins of the lower limb are provided with valves to direct the blood flow to the heart, particularly against gravity in the upright posture. The valves are numerous in the deep veins than in the superficial veins. The veins from the muscles draining into the deep veins are valved except in the soleus. So the veins that is seen, that is from the muscle which is draining into the deep veins are valved except in the soleus. In the soleus, they are arranged in the form of venous sinuses and they do not have valves. And the blood flow is sluggish in the soleus sinuses when the muscles are at rest. So prolonged rest in bed, as adopted by some patients after surgical operations, is unwise because it may develop deep vein thrombosis. So the blood flow through the soleus sinuses is sluggish when the muscles are at rest. So the prolonged rest is unwise because it may develop deep vein thrombosis and culminate into severe complication of pulmonary embolism. The perforating veins are valved at each end and permit the blood flow from superficial to deep veins and not in the opposite direction. So they permit the blood flow from superficial to deep veins. The Achilles tendon or tendocalcaneus or calcaneal tendon. It is a tough band of fibrous tissue that connects the calf muscles to the heel bone. So the Achilles tendon is also called as calcaneal tendon. So the gastrocnemius, the medial head and the lateral head of the gastrocnemius around the middle of the thigh. Then this muscle belly is entered there around the middle of the thigh. Then tendon starts. So it is anterior aspect of this tendon also contain the soleus muscle and the tendon of this gastrosoleus. They form one band, the gastrocnemius and the soleus. It unite to form one band of tissue which becomes the Achilles tendon at the lower end of the calf and they inserts to calcaneum. So small sacs of fluid called bursae cushion is there. It cushions this Achilles tendon at the heel. Some bursae are present there and it cushions this tendon at the heel. And the Achilles tendon is the largest and strongest tendon in the body, around 15 centimeter in length. So when the calf muscles flex, Achilles tendon pulls on the heel. So this movement allows us to stand on our toes when walking, running or jumping. So this is strong plantar flexor of the foot. Despite its strength, and this tendon is also vulnerable to injury due to its limited blood supply and high tensions placed on it. Clinical conditions that are related to this tendon. One is Achilles tendon tear. Tears of the Achilles tendon can be tiny or large. It causes pain, swelling and impaired movement. They may occur suddenly during activity or gradually over time. So tendon tear. Then the tendon rupture. A complete rupture of the Achilles tendon may make a pop sound, then followed by a pain and swelling of the lower leg. Treating an Achilles tendon rupture requires surgery or long-term immobilization of the ankle. These two things can be done. That is immobilization for a long term of the ankle for a long term, and other requires surgery. The other one is Achilles tendinitis or tendonitis. Frequent activity, that is running or walking, can gradually inflame the end of the Achilles tendon, causing pain and stiffness at the back of the heel. Rest, ice and stretching may speed healing, which can take weeks. Achilles peritendonitis. Similar to this Achilles tendonitis, but inflammation and pain occurs in the tissue surrounding the tendon, often 2 or more inches above the heel. That is the difference. So the inflammation and pain occur in the tissue also surrounding the tendon. Other one is Achilles tendinosis. That is gradual thickening of the Achilles tendon without apparent inflammation due to aging or overuse, the gradual thickening. Despite the thickening, the tendon is weakened and prone to further injury or rupture. Other condition is Achilles tendinopathy. A general term for tendinitis or tendinosis affecting the Achilles tendon is known as Achilles tendinopathy. Then the other condition is Achilles or heel bursitis. So low riding shoes can irritate the bursa. Bursa is a sac of fluid cushioning the Achilles tendon at the heel. So it can irritate the bursa. So pain in the back of the heel, worse with shoes on, is a common symptom. So this is bursitis. And to test this Achilles tendon rupture, there are some tests, that is Thompson test and Mattels test. In Thompson test, lying prone or while kneeling on a chair, examiner will squeeze the calf. The end of the foot should move downward in response. That is plantar flexion. That the end of the foot should move downward in response. If it does not, the Achilles tendon rupture may present. Other one is knee flexion test or Mattels test. A person lies face down and bends the knee slowly to right angle. During this movement, the toe end of the foot should point away from the leg slightly. During this movement, the toe end of the foot should point away from the leg slightly. If it does not, again, an Achilles tendon rupture may be present. And this tendon rupture may result from advanced age which results in decreased blood supply to the inside of the tendon, and due to the strenuous physical activity, direct trauma, unexpected forcing of the sole of your foot upward as in landing on your feet after jumping from a height. So it can also cause a tendon rupture. Then excessive strain while pushing off with weight bearing foot, and having group O blood type. This is controversial cause and effect relationship. Research is going on regarding this. So these all can be the reasons. Advanced age, so there will be decreased blood supply, strenuous physical activity, and unexpected force on the sole as in landing on your feet, direct trauma, and all these conditions can cause the rupture of the Achilles tendon or tendocalcaneus. And the tendon treatment without surgery involves, one is immobilizing your foot at the ankle so that the sole of the foot is pointed downward for 4 to 8 weeks. That is immobilization of your foot at the ankle for 4 to 8 weeks. This treatment has been advocated by some because it gives similar result to surgery in motion and strength. The problem with this treatment is that it has a re-rupture rate of up to 30%. Nevertheless, it may be still a reasonable option for those who are at increased operative risk because of age, medical problems or inactivity. So, in the treatment, we can do surgery or immobilization of your foot without surgery. But this immobilization of foot for without surgery is helpful for the persons which have risk of age, medical problems or inactivity. Thank you.